ready?
We are.
Wonderful. Well, welcome everybody. Good morning and welcome to Cook County Health. Thank you all for being here. I'd like to share our deepest thanks with Senator Duckworth for her securing nearly $900,000 to support the updating of equipment for Cook County Health's Neonatal Intensive Care Unit. Your support is truly humbling, and it means so much to our patients, our team, and our community, Senator. Thank you, as always, for all that you do to advocate for Cook County Health, our organization, lives here in Chicago and Illinois overall. I would also like to thank President Preckwinkle for her ongoing support and advocacy on behalf of our health system. At Cook County Health, we often see some of the region's sickest patients and the most vulnerable. Today, even highlighting our littlest ones, as you saw today in our neonatal care unit. That includes some of our most neediest patients. Over the last few years, Cook County has cared for nearly 1,000 tiny patients in our NICU, guided by our amazing physicians and our care teams. Being able to have access to this equipment, including state-of-the-art incubators, infant warmers, and other elements of critical care, is essential for us to be able to carry out our mission of ensuring health equity and health success for everyone. Having a child in the NICU can be incredibly scary. Nationally, the average child stays in the NICU is for almost 14 days. At Cook County Health, we want our families and our tiniest patients to be cared for with the latest technology and to be assured that they will have the best possible success for their care. So on behalf of the many families who will benefit from this, we thank you, Senator Duckworth, for your steadfast support in our health system and helping us to advance the work that we do. I also want to share a few remarks in Spanish. Buenos días. Gracias por estar aquí con nosotros. Muchas gracias a la senadora Duckworth para su trabajo en asegurando casi 900 millones de dólares para reemplazar el equipo de nuestra unidad de cuidados intensivos para recién nacidos. El año pasado, Cook County Health atendió casi 300 bebés prematuros en nuestra unidad y cuidados intensivos neonatales. Poder tener acceso a nuevos equipos es fundamental para poder avanzar en el cuidado de nuestros pacientes más chicos. Now we'll turn over the comments to President Toni Preckwinkle.
Good morning, everyone.
Good morning.
Good morning.
I want to thank you all for joining us today. I want to especially thank Senator Duckworth for her support in securing funding for new equipment in the Neonatal Intensive Care Unit at Stroger. I'd also like to recognize Cook County Health CEO Israel Rocha and our Chair of Pediatrics, neonatologist, did I do that right? Neonatologist? All right, Dr. Mopelola Akintorin, who are putting their dollars to work here at Stroger Hospital. I want to thank Senator Duckworth for her advocacy. Newborns who require special attention, including micro-preemies, as small as a pound, and babies born with serious illnesses will have access to modern high-tech equipment that's reflective of the innovative care that's provided here. Senator Duckworth has always been a strong advocate for supporting moms and their families. She sponsored the Access to Baby Formula Act, which was signed into law to address the infant formula shortage for families who rely on WIC, and gives the USDA the authority they need to be more flexible during such a crisis. She also introduced legislation to expand access to donated breast milk for parents and their medically vulnerable infants at nonprofit milk banks nationwide and make it easier for parents to safely travel with breast milk. As a mother and a lawmaker, Senator Duckworth continues to be a champion for the most vulnerable and our greatest treasures, newborns, infants, and children, working to ensure families have access to care needed to grow and prosper in a healthy manner. Thank you very much, Senator Duckworth.
Thank you, President Preckwinkle, and thank you, Mr. Rocha, for having us here at Cook County Health today. I think the last time we were together was during the pandemic when we worked so closely together, and I was just so proud to watch the work that you and President Preckwinkle did to secure this health and well-being of the residents of Cook County. I'm really proud that I was able to get this money for our health care, for Cook County Health's Caring for High-Risk Infants project. This funding is going to go a long way towards modernizing Stroger Hospital's Neonatal Intensive Care Unit. I know, and I'm sure many of us here know, how difficult being a new parent is. The sleepless nights, the tears, doing everything you can to make sure our babies are safe and healthy. But for babies born prematurely or with complications, this stress is only increased Vulnerable infants in the neonatal ICU need high-quality care for the strongest chance at growing and thriving. And, we need to make sure that these babies have everything that they need initially to be healthy and to grow. And it should not be dependent on your income level, the neighborhood you live in, or the color of your skin. Everybody deserves the highest level of care for their newborns. So I'm really proud to see that this funding will help Stroger Hospital purchase new state-of-the-art NICU equipment, replacing existing equipment that's nearly 2 decades old. And these updates are long overdue. And there will be no more advanced unit anywhere else in the country. These will be state-of-the-art. This project is a prime example of the great work we can do through congressionally directed spending. And each year, my office uses an independent review board, examines and evaluates hundreds of projects from around our state. In this particular case, we had over 550 projects that applied. About 55 were selected by my independent review board, and of those, I fought for as many as I could, and we got about 42 of them funded. So this is a very narrow group that were able to get funded, but I'm so proud that we were able to do this. And this funding will allow us to support communities and families all across the state. In this case, it's for neonatal care, but we also were able to get funding to help secure funding, to help clean up our water, to improve our state's infrastructure, to expand healthcare access, create jobs, tackle environmental justice issues, and of course, to help the most vulnerable newborns. And I'm proud of all the great projects we've been able to support through the CDS program. So thank you again for having me here today, and I look forward to coming back soon and seeing all the updates and the little babies, because I love seeing little babies. I was like, oh, I wish mine were little again. And with that, I'm going to, is Dr. Akintorin going to say a few words?
Yeah, I just want to say that we are so grateful. The premature babies are really special to us. The smallest baby we've taken care of was just 1 pound, and we are really happy to have this equipment because our equipment is almost close to end of life. So, Senator, thank you so much. On behalf of Cook County, we're so grateful for all you've done for us.
Thank you. And we're happy to open up for questions.